My name is Karen Talbot. It's good to be here. I'm going to share a little story about how I kind of changed my mind about healthcare, because I used to be, like my husband says, people that think, I'm all right, Jack, you know. If I can have healthcare, everybody can have healthcare. I worked, I had a good job, I had good health care. Of course, I paid through my employer. I had no complaints about my health care, and I really felt like, you know, if I can do this and I can have health care, then certainly anybody could do the same thing. Then in 2009, one of my brothers, he worked all the time, but he wasn't fortunate enough to have a job that gave him health care. And he was 46 years old. He went to the hospital. They diagnosed him with cardiac issues, and he had, it's like an infection through your bloodstream. So they treated him in the hospital, kept him for a couple days in ICU, and then he went home, and he continued to have problems breathing, and he wasn't doing real well, but he was still getting around, going to work, and then he got pretty sick. You know, my dad told him, you need to go to the hospital, and my brother said, no, because I can't afford the bills. And my father found him dead in bed. And that will change your mind quickly. And ever since then, I have thought, look at the country we live in. We should all have health care. And let us pay for it, but let everyone pay for it and let everyone benefit. Because this is too great a country to let people die because they don't have health care.